You go to the gym for health, yet somehow you wreck your lower back. This complaint is incredibly common. Worse, the person is serious, trains frequently, watches form videos, yet one day, suddenly or gradually, the lower back reaches its limit. The first thing to understand is that lower back pain isn't explained just by weak willpower or weak core. Lower back pain involves multiple factors, but physically, there definitely exists a pattern common among people prone to injuring their backs. Most often, strength training itself isn't bad, but the alignment of load, movement, and recovery has collapsed. Research shows exercise prevents lower back pain, with systematic reviews of randomized controlled trials, demonstrating exercise intervention reduces pain occurrence. However, conditions harsh on the lower back, like high physical load, repetitive lifting, and trunk flexion, plus twisting, are organized as lower back pain risk factors. Popular gym hinge movements like deadlifts become powerful weapons when used correctly, but can impose large mechanical loads on the lumbar region. So what do people who go to the gym yet injure their backs commonly do? Lower back. Pain isn't just muscle weakness. Common patterns include increasing load faster than the body's adaptation speed, where effort precedes tissue tolerance capacity. Core training becomes just abdominal exercises, and bracing during movement drops out. Hip joint and thoracic cage mobility deficiencies get filled in by lower back compensation, where movement looks clean but only the lower back works. Fatigue, sleep, and recovery get neglected, making form variable daily. Pain signals get treated as growing pains, missing micro-adjustment opportunities. The lower back gets stronger with training, but quietly wears down when used incorrectly. The scary part is that by the time pain appears, the accumulated pattern is already complete. Conversely, knowing common patterns makes countermeasures quite specific. Many people who injure their backs at the gym consciously protect their backs and brace their cores during training. Yet actually, this consciousness and effort often creates movement, concentrating work on the lower back. The lower back isn't originally a place for large movement, but a place relaying and distributing force. Force generation mainly comes from hip joints, force direction, adjustment from thoracic cage and shoulder girdle. The lumbar spine between them plays a role transmitting whole body force while keeping movement minimal. But commonly seen is this role distribution collapsing. Take squats or deadlifts. Originally, hip joints perform bending and extending, while the core functions as an immobile pillar. However, when hip joints don't bend sufficiently, thoracic cage is rigid, preventing upper body angle. Adjustment and abdominal engagement consciousness equals sucking in the belly. These conditions combine and the body unconsciously compensates with lumbar, flexion extension, or hyperextension. Form looks reasonably organized externally, but internally only the lower back works busily. Critically, the person has almost no awareness, no sense of arching the back, no feeling of rounding, just feeling intense and heavy while completing repetitions. Consequently, each repetition accumulates shear force and compression, force on the lumbar spine. Research context shows lower back pain risk rises not from mere weight, but from combinations of repetition, count times, insufficient control, times fatigue. Meaning, not breaking from one attempt, but repeating breaking movements hundreds of times incorrectly. Further deepening the problem is core training misunderstanding. People working hard at planks and abdominal exercises often have core dropout during actual lifting movements. The reason is simple: core training and core control during movement are different things. Floor core training has little external disturbance and predictable load. Conversely, handling barbells or dumbbells means constantly changing center of gravity and disrupted breathing. What's needed is maintaining abdominal pressure while breathing, keeping lumbar spine still while hip joints move, and maintaining control despite fatigue. These are movement-specific core functions. Without acquiring this, increasing weight alone doesn't mean weak core, but fixates the habit of enduring with the lower back without using core. The common pattern among back injury people isn't overusing the lower back, but creating situations where everything except the lower back doesn't work. Another clear common pattern exists among gym back injury people. They don't skip training, they're serious with continuity. Decisions like trying heavier today, increasing reps from last time, or doing one more set since I came seem like ideal growth thinking. But from lower back pain perspective, a major pitfall exists here. The body doesn't strengthen uniformly. Strength training results appear first in visible areas. Strength, pump feel, weight records. These change within weeks. Meanwhile, tissues protecting the lower back, intervertebral discs, ligaments, fascia, deep muscles, and nervous system control capacity adapt. Slower than muscle. Meaning, even when legs and back have capacity, cardiopulmonary system has no problem and form doesn't visibly collapse. The lower back area alone commonly nears its limit already. Particularly problematic is weight times repetitions, times frequency accumulating unconsciously. Each movement is endurable, but continuing this 2 to 3 times weekly for months, without managing this total load volume, makes the lower back quietly deteriorate. Form not collapsing isn't safe. Many place load-setting judgment criteria on form. But misunderstanding exists here too. Form is already too late as an indicator when it collapses. Lower back control gradually becomes ambig. Thanks for watching. Please hit that subscribe button and give us a thumbs up.